When a patient goes to their general practitioner complaining of bowel symptoms such as bleeding or alteration of bowel habit to increase frequency, then they're referred on a rapid 2-week wait pathway. Normally, the routine process would be they'd come to outpatient clinic first, which could take up to 14 days for that appointment to be available. And then at clinic, they would then be normally referred on for a test, which is commonly a lower GI endoscopy, either colonoscopy or flexible sigmoidoscopy. So it could be 28 days between seeing their general practitioner and actually having a test for what was suspected possible signs of bowel cancer. What straight to test does is it gives a phone call to the patient and means that they don't have to come to outpatients first. They can go straight to the procedure, which will identify whether they've got bowel cancer or not.
I'm calling regarding the referral that we received from your GP. My role is to triage patients being referred to the Homerton Hospital for suspected colorectal cancer. I do this via clinical telephone assessment. Have you had a heart attack in the last 6 weeks? No? Thank you. Any heart conditions that I need to know?
We have a pro forma based triage with some carry forward logic, so if you answer yes to one question, it will automatically help you make the decision.
Any family history of colorectal cancer?
So it does help the specialist nurses work confidently and competently.
Basing on your symptoms, I am now going to book you to come in for a procedure called a colonoscopy to investigate why you're having your symptoms.
Ideally, we would like everyone to go straight to test, but not everyone's appropriate. We have an age range of 35 to 80. Reasons why they might not be suitable is you may not be able to contact them. They may not have English as a first language. Some patients have dementia and therefore it would be inappropriate to have a telephone consultation. And there are a percentage of patients who don't wish to go straight to test. The planning of the service is crucial. It took us 6 months of weekly meetings with work between the meetings of all people who are involved before we went live. There's certainly a financial benefit to the Trust in the fact that we have the same number of outpatient appointments available, but we're not having to see the 2-week wait patients who are going to have a test anyway. So we've got increased capacity, both for routine and emergency reviews in outpatients. We can essentially do more work with the same number of doctors, nurses and support staff.
Are you free on Monday afternoon next week? Oh, brilliant. Thank you.
We have a very good attendance rate for people who've been through the straight to test pathway. The patients really benefit from having a rapid access to a test, which gives them an answer on the day, mostly, whether they have colorectal cancer or not.
Now, their symptoms are being dealt with quickly, sooner.
And it is the service that patients really do want to see. It really is an excellent way forward.